In this patient's case, she had a very high-risk tumor, but it was still very early stage. So we were able to do the operation through a keyhole surgery with small incisions using robotic technology, which allowed us to do really precise.
And luckily, nothing has come. So I am perfectly healthy right now. I came with an appendicitis to the emergency room, and it wasn't that painful, and I wasn't going to come, but I decided to come and see what it was. And I was diagnosed with appendicitis after a CT, and spent the night in the clinic because it was a Saturday, almost at midnight. And next day, Dr. Anas operated on me. It was very simple, laparoscopic, and Dr. Anas explained what they found and the treatment, which was a very invasive surgery. And they needed to remove several organs. They needed to do HIPEC chemotherapy. And that was really a shock because I had never experienced any symptoms other than the appendicitis. And my recovery was amazing. I mean, I only spent one night in the ICU and then 6 nights in the hospital. I had no issues. All the drainage was removed. Everything was great because they didn't have to really do a big cut, and they did it with the robot. I had several incisions, but they were not like really bothering me. But I was doing my normal life after a month. And after that, my husband and I started taking care of ourselves a little bit more, exercising, doing better with the food. And a year after, I have had 2 follow-ups, MRIs, blood tests, and luckily nothing has come back. So I am perfectly healthy right now.
Regarding our first robotic HIPEC surgery, cytoreductive and HIPEC surgery here at Clinic Abu Dhabi. So this was a great milestone for us and for us here in the whole United Arab Emirates, as it's the first of its kind of this type of procedure. These cytoreductive surgeries are very complex surgeries which usually require a large incision from the chest bone all the way down to the pubic bone, and often take 12 to 14 hours, where we remove multiple tumors and organs from the body. In this patient's case, she had a very high-risk tumor, but it was still very early stage. So we were able to do the operation through a keyhole surgery with small incisions using robotic technology, which allowed us to do really precise surgery and still remove multiple organs and complete the whole procedure while giving her the benefits of a much faster recovery, less pain, less problems with her wounds, such as infections and hernias later down the line. So it was a great achievement and accomplishment for us here at Clinic Abu Dhabi. In this case, we preferred the robotic approach because it gave us the opportunity to achieve the same surgery inside while giving her the benefits of minimally invasive surgery, which is faster recovery, less pain, less scarring, and then less short and long-term complications from the wound. In her case, she did not have extensive tumor throughout the abdomen, but it was a very high-risk tumor which, if left alone and not treated properly, could develop into something we call jelly belly, where the abdomen fills with this mucinous material and then requires a much bigger operation. So our goal in her case was to prevent her from developing that. So we were able to do that with the same surgery with smaller incisions. So she was a great candidate for this robotic procedure. And we were able to remove all the organs that we required. So in these types of surgery for different patients, we usually have to remove some of the fat in the abdomen called the omentum, often the gallbladder, the ovaries, sometimes the area where the appendix sits on the large intestine called the cecum. So we're able to do that and also remove part of the lining of the abdominal cavity called the peritoneum. And with the robotic technology, it really allows us to go to these different areas, and with extreme precision and dexterity, we can perform the procedure even though we don't have our hands inside the patient.